Definition: an electronic apex locator is an electronic device used in endodontics to determine the position of the apical foramen and its location and thus determine the length of the root canal space. Electronic apex locators. These are the electronic devices that have been developed for determining the working length of a root canal without resorting to radiography. Currently, electronic apex locators is the most optimal and accurate method to establish the root canal working length. Electronic apex locators is used to locate the apical constriction or cemento-dentinal junction apical foramen but not the radiographic apex. Hence, the term apex locator is a misnomer one. Components of electronic apex locator: lip clip, file clip, electronic device, cord which connects above three parts. Classification: according to generations of electronic apex locators. First generation apex locators: resistance based apex locator. Second generation apex locator: impedance based apex locator or low frequency apex locator. Third generation apex locator: high frequency apex locator. Fourth generation apex locators are multiple frequency ratio based apex locator. Fifth generation apex locators are dual frequency radio type. Sixth generation apex locators are adaptive apex locators. McDonald's classification on the basis of type of current flow. Types of apex locators. It is classified as based on direct current and based on alternating current. Based on direct current, original OHM meter used by Suzuki and Sunat. Based on alternating current, there are three types: resistance type, root canal meter, endodontic meter, and impedance type, which is Sono Explorer, and frequencies type, in which subtraction type, index, Neo Sonot Bima, EZ. Uses of apex locators: it provides objective information with high degree of accuracy. Useful in condition where apical portion of canal system is obstructed by impacted teeth, zygomatic arch, tori, and excessive bone density, overlapping roots, shallow palatal vault. Useful in patients who cannot tolerate X-ray film placement because of gag reflex. Useful in pregnant patient to reduce the radiation exposure. Also useful in children who may not tolerate taking radiograph, disabled patients, and patients who are heavily sedated. Valuable tool for detecting site of root perforations, diagnosis of external and internal resorption which have penetrated root surface, and also used in detection of horizontal and vertical root fracture or determination of perforations caused by post preparation and testing the pulp vitality. Contraindication: older apex locators were contraindicated in the patients who have cardiac pacemaker functions. Electrical stimulation to such patients could interfere with pacemaker function, but this problem has been overcome in newer generation of apex locator. Mechanism of action of apex locators: root canals are surrounded by dentin and cementum that are insulators to electric current. The resistive material of the canal with a particular resistivity forms a resistor, the value of which depends on the length, cross-sectional area, and the resistivity of the materials. Apex locators use the human body to complete an electrical circuit. One side of the circuit is connected to an endo instrument and the other end to the patient's body. The impedance between the lip and the periodontal ligament is a known value 6.5 kOH, so as the file tip is advanced towards the PDL and the electronic apex locator detects the changing impedance values and indicates the approach to the apex on its screen. First generation apex locator: it is also known as resistance apex locator, which measures opposition to flow of direct current, that is resistance. It is based on the principle that resistance offered by periodontal ligament and oral mucous membrane is the same, that is 6.5 kg. Examples of first generation apex locators are root canal meter, endometric meter, dentometer, endoradar. Advantages: it is easily operated, digital readout, audible indication, detect perforation, can be used with K-file, may incorporate pulp tester. Disadvantages are it requires a dry feel, patient sensitivity, requires calibration, requires good contact with lip clip, cannot estimate beyond 2 mm, file should fit snugly in the canal, file should not contact metal restoration. Next is the second generation apex locator or low frequency apex locator. It is introduced the concept of impedance based apex locator which measure opposition to flow of alternating current or impedance. This apex locator indicates the apex when two impedance value approach each other. Examples are Sono Explorer, Apex Finder, Exact Apex, Endo Analyzer. Advantages are does not require lip clip, no patient sensitivity, analog meter, detects perforation. Disadvantages are no digital readout, difficult to operate, canal should be free of electroconductive irrigants and tissue fields, requires coated probe. Third generation apex locator or high frequency apex locator. It is based on the fact that different sites in canal give a difference in impedance between high and low frequencies. Various third generation apex locators are Index, Mark 5 Plus, Root ZX, Root ZX2, Root ZX Mini. Advantages: easy to operate, uses K-type file, audible indication, can operate in presence of fluid, analog readout. Disadvantages: requires lip clip, chances of short circuit, needs fully charged battery, must calibrate each canal, sensitive to canal fluid level. Next is the fourth generation apex locator. Fourth generation apex locator measures resistance and capacitance separately rather than resultant impedance value. There can be different combination of values of capacitance and resistance that provide the same impedance and the same for minimal reading. However, by using fourth generation apex locator, this can be broken down to primary components and measures separately for better accuracy and thus less chances of occurrence of errors. Examples of fourth generation apex locators are AFA Apex Finder, IPEX, RAAPEX 4. Next is the fifth generation apex locators. To overcome the disadvantages of previous generations of apex locators, fifth generation electronic apex locators have been developed, which is based on comparisons of data taken from the electrical characteristic of the canal and additional mathematical processing. These show accurate reading in presence of dry, wet, saline, EDTA, blood or sodium hypochlorite. Examples of fifth generation apex locators are RAAPEX, Propex 2, Propex Pixi, iRoot. Sixth generation electronic apex locators or adaptive apex locators. This apex locator is intended to overcome the disadvantages of fourth and fifth generation electronic apex locators. It eliminates the need of drying the canals. Examples of sixth generation apex locators are Adaptive Apex Locator, RAAPEX 6. Advantages of apex locators. It provides objective information with high degree of accuracy. Accurate in reading. Some apex locators are also available in combination with pulp tester and can be used to test pulp vitality. Disadvantages of apex locators. It can provide inaccurate readings in the following cases: presence of pulp tissue in canal, too wet or too dry canal, blockage of canal, incomplete circuit, low battery, chances of overestimation, incorrect reading in teeth with periapical radiolucency and necrotic pulp associated with root resorption, etc., because of lack of viable periodontal ligament. Conclusion: the electronic apex locators are now considered the most ideal method to measure the working length of a root canal. They can be used alone without the need of radiograph. However, it is recommended combined use of an apex locator along with the radiographic technique for accurate clinical measurement of root canal working length. Thank you.